Hi everybody, it's Kim Bergen-Jackson, administrator at Oak Knoll, and I'm back to do our weekly COVID update. I was gone for vacation, and then I know some of you heard I went on a cruise, and cruises are like little petri dishes of disease, and I got influenza A, no joke. So I'm back, I'm feeling 100% today. I slept really good last night, so I appreciate all of your messages about where you're at and what are you doing and are you okay? I'm fine. It's a risk we take, right, when we travel now, that there are bugs everywhere. So my message is going to be the same, to, be careful when you're in crowds of people and wash your hands. And even when you do all of the right things, you may still get sick. But we're all vaccinated, and I got the flu shot, but I must have been extra tired or something, and my immune system didn't work for me. So COVID, COVID is becoming less and less of a topic of conversation as we go further and further into the pandemic. We celebrated our third anniversary of COVID recently this month. And the public health emergency, the national public health emergency, is set to end May 11th, which is a random day. I don't know why they picked May 11th, which is, I think, a Thursday. But once that stops, there will be some changes. I don't think we're going to have access to testing supplies as we have this whole time, which is fine, because if you remember, before COVID, we always went to the doctor, and the doctor decided if we needed a test. And I think that's probably the way we're headed, is that if you have symptoms, cold symptoms or a fever or cough, you'll go in to see your primary care provider, and then they'll order a respiratory panel. That's what happened for me when I got back from the cruise. And I was surprised it wasn't COVID and that it was influenza, but I think that's how we're going to move forward. So you won't be receiving free tests at home after the May date. And at the end of this month, March, Iowa will stop recording data. Well, what does that mean for us? Not much necessarily. We've sort of been making our own decisions together along the way. We won't have information on county positivity, but the information that we have now, it's unknown to me if we have 100% of the story, because negative tests aren't required to be reported, and people are doing home tests and they're not reporting when they're positive. And so the data we've had over the past couple months has been kind of sketchy anyway. So I'm fine with Iowa stopping at the end of March, and we will just continue to sort of look at our community and how we're doing as to make decisions about mask wearing. So currently, Johnson County is in the moderate level, which is pretty normal, pretty standard right now, I think. There are always going to be some cases. Oak Knoll, we have a couple of staff who are out with mild symptoms and recovering at home. And then we have, I think, just one resident right now with COVID who is also mildly symptomatic and recovering at home. So we're in a good spell right now. Good. You'll see that we remove the masks in independent living if staff are comfortable with that. We have not taken the masks off in the health center yet, but we are closer. We're getting closer to that. I just know as soon as we take the masks off, we're going to have a COVID outbreak, and I need to get over that fear and just move on. But soon I'll take the masks off in the health center. What you will notice is that we are no longer required to have people screen in at the health center anymore, and so I have ended the contract with AccuShield, and those nifty little machines are going to disappear. They already disappeared from independent living, and we moved them down to the licensed areas, the health center and assisted living, and very shortly we're going to remove them. So what I would ask is, if you're sick, don't visit. That's what I've said this whole time. If you're symptomatic with whatever, just don't visit. Or if you're going to visit anyway, wear a mask. Because we have shown time and time again that the masks help reduce the spread. And so you may see some people in independent living who are wearing masks. That is completely fine. It is a matter of personal preference. I've been wearing my mask because I'm still coughing from influenza, although I'm not contagious anymore. I just didn't want to make people feel uncomfortable when they're around me, because I smoked for 20 years, so my cough is terrible. So don't smoke. That's my PSA for today. Don't smoke. So wear your mask if that makes you more comfortable. Don't spend a lot of time in big crowds, although I know you're all watching women's basketball, because those those games are sold out, and they're on their way to the Sweet 16. So I'm not very sporty, but I am excited for the women's basketball team. So if you're going to do that, just keep an eye on yourself. That's what we're doing right now. We're monitoring for symptoms, and if we feel kind of crummy, we need to figure out what it is. And the respiratory panel that I had at the doctor's office tested me for COVID, influenza, RSV, pneumonia. I feel like there was one more I'm missing. But anyway, it doesn't matter. They can test for a lot of things now. And the treatment for influenza is the Tamiflu, and the treatment for COVID has been the Paxlovid, although not everybody qualifies for that antiviral treatment, so you have to really talk to your medical provider. So get ready, because we're going to stop talking about COVID soon. I can feel it coming, and we're just going to talk about fun things, although I'm not prepared to talk about fun things today, because I just wanted to make sure I taped today. So check out the calendar for the up-and-coming fun events that I know are coming. Let me know if you have any questions. Wear your mask if you want to. Always wash your hands. Always good advice. And I will come back and see you in 2 weeks. I hope to see you around. Today's taco day, so maybe I'll see you in the dining room. Bye.